Hello everybody, my name is Dr. Kira. I hope you guys are doing well. I'm doing fine. And today we are going to do a root canal. I meant to say we're going to do a wisdom tooth removal. So I myself have never had this done, but I've had friends who have had it done. You know who you are, and based on what I'm seeing right here, based on just this, I feel your pain already, dude. So, here we go.
Welcome to Surgery Squad's virtual erupted wisdom tooth extraction. I'm Dr. Jeff, and I'll be walking you through this procedure today. A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars, commonly known as wisdom teeth. Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems. Our patient today is having their lower right wisdom tooth removed, or, as a dental professional may refer to it as, tooth number 32. Before we begin, let's get some x-rays taken of our patient's teeth. X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started.
Okay.
First, insert a positioner into the patient's mouth.
Okay, get in there.
Next, position the X-ray cylinder where indicated.
Okay, there we go.
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure. I couldn't have done it better myself. I'll have my assistant finish up the rest of the X-rays, and then we'll view the resulting images. Well, everything appears to be normal with the wisdom tooth's roots, and now that all of the X-rays have been completed, we can extract our patient's wisdom tooth. The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have two or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic. To begin, you'll need to apply a topical numbing gel to the anesthetic injection site. This will help decrease any pain.
Shut up, Jeff.
Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted.
Okay.
After that, the area will become numb for a few hours.
Okay, get in there. I hate needles so much.
And now we'll give our patient a few minutes to become completely numb. Great, the patient's mouth is numb, and now we can move on to removing the wisdom tooth. First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
Okay, let's do it.
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
Do I have to?
Now clean the area using a surgical suction. This will allow us to check the area for any bony matter or tooth structure that may be left in the socket.
Okay. Okay, so spray the water, okay. That's gotta be ice, like ice touching a bare nerve.
Everything looks great, but we're not done yet. Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot. Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth.
Mouse, fuck off.
When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity. Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours to reduce swelling, refraining from physical activity for the first few days, avoiding sodas and the use of a straw, and gently rinsing your mouth out with warm salt water to help relieve pain after the first 24 hours. It's also suggested that patients do not smoke for at least 24 hours after their surgery. Smoking may not only delay healing, but it will also reduce the blood supply and could introduce germs and contaminants to the surgery area. And that's a wisdom tooth extraction. You did great. If you're up to it, why not try another procedure on surgerysquad.com.
Okay, before I do that though, I'm curious, why does it, why is it that you can't use a straw when you take out your wisdom teeth? I mean, because the straw goes in the front of your mouth, not the side where the wisdom teeth are. I don't know. I don't get it. Okay. We're going to find another surgery, another YouTube-appropriate surgery, unlike last time, to do. And then we will do that. So, give me 1 minute. I will see you guys in just a minute. Okay, guys, we're back, and this time with a gastric bypass surgery. All I know about it is that when a big guy, like, say, for example, me, goes in, they go in and, like, cut your stomach and do all this other stuff. I don't know much about it, so let's jump right into it, shall we? Again, as always, with Surgery Squad, or for that or Surgeon Simulator for that matter, this is not for the faint of heart. So, if you are faint of heart for this particular surgery, as per usual, I will give you 5 seconds to go, starting now. Okay, if you're still here, that means you want to watch the surgery. So, let's jump right on in, shall we?
Welcome to Surgery Squad's virtual laparoscopic RNY gastric bypass surgery. I'm Dr. Jeff, and I'll be your guide for this procedure. Are you ready? Let's scrub in. Gastric bypass surgery is designed to assist an obese patient in weight control. In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine. There are several common types of gastric bypass surgeries. We've recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into shape in about 5 minutes.
Yeah, sure.
Our patient has been prepared for the procedure with a mild sedative, and now the anesthesiologist places a mask over her nose and mouth, and she'll drift off into dreamland. From here, we'll place an endotracheal tube down the patient's throat. You're up. See if you can get the tube into place.
Okay.
Great work. This tube is then connected to a respirator. The patient is ready to go. Now we can begin our laparoscopic procedure. The first thing we'll do is make 6 half-inch incisions in the abdomen. Slide the scalpel in where I have marked to make the incisions. Be careful, these are small incisions. Don't get carried away.
Again, warning, if you want to go, go. I'm not going to blame you. 5-second warning. Okay, here we go.
Nice technique. You must have an excellent teacher. Oh wait, that's me. Next, we'll place a device called a trocar into each incision.
Okay, what you want to explain what the trocar is?
These devices allow us to easily slide the instruments into the abdomen. Some of the instruments we'll use include a light and a camera, so we can see what we're doing on a video monitor, as well as the surgical instruments, such as the stapler.
So it's kind of like the colonoscopy surgery that we did, only with a lot more complex.
Now, to give us plenty of room to work, we fill the abdomen with carbon dioxide.
Carbon dioxide, isn't that lethal, though?
Let's face it, with a newbie helping out, we'll need all the room we can get. Time to start the gastric bypass. We'll use this monitor here to see our work. In RNY gastric bypass, we eliminate up to 90% of the stomach by making the patient's stomach the size of an egg. We do this by first placing a line of staples that separate the smaller new stomach from the whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation. Click the stapler where indicated to create the new stomach pouch.
Okay. Ooh.
We'll now separate the small intestine from the old stomach, about 2 feet down. The lower part of the intestine will be connected to the new, smaller stomach with a half-inch opening between the stomach and the intestine.
So then what the hell
It's kind
is
of like
this?
rerouting traffic on the 405. Use the electrocautery device to create a half-inch opening where indicated in the new stomach pouch. Now, drag the loose end of the intestine to the new stomach pouch to attach it. I'll add some sutures to hold it all in place. Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the free end of intestine attached to the old stomach over to the spot on the small intestine where indicated. Again, I'll suture it all into place. The new smaller stomach pouch was created. Everything has been reattached, and we checked for any leaks in the sutures. This new configuration allows our patient to feel full sooner when eating, but also lets the fluids from their original stomach aid in the digestive process. I'll need you to remove each of the laparoscopic instruments and trocars. Now we need to suture each of the incisions.
Okay.
Nice work. I bet that won't even leave a scar. Now our patient goes off to recovery. In most cases, they'll spend a few days here in the hospital so we can monitor their progress. Afterward, our patient will meet with her doctor and a nutritional specialist. They will assist her with her new lifestyle and eating habits. You've been a great help. Why not try another fantastic surgery at surgerysquad.com.
Okay, guys, that was both the wisdom tooth removal and the laparoscopic gastral bypass. If you like this video, slap the like button in the face, and as always, I will see you in the next video. Bye-bye!